Hi there, this is the Health Seniors Human Services Youth Education Human Rights Committee meeting. My name is May and I am the chair. So we're going to start the meeting. Before we have quite a long agenda, but before we start the meeting, we will have Tahisha, who's our secretary for today, to take the attendance and approval of the minutes.
So, Maisie,
Here,
my friend is not here. Eric Diaz, here, Tisha Fields, I am present. Naomi is not here, correct?
yeah, now you know.
Danny the car,
She is not here now.
okay. Robin. Rima.
Here,
That's what the president put
Ramya.
Ramia, okay, thank you. Ronnie.
Here.
Arnett,
Arnett has an excuse leave, she's on leave.
okay. And Carmen, who says is a public member.
Mhm.
Okay,
She is not here, so she's absent now. Okay, so one more thing, I emailed the minutes of the last meeting to all the committee members. Does anyone have any changes or? Changes, additions, anything they want to change to the minutes? No. Okay, so the minutes are approved. Okay, so our first agenda item will be from the Chinese American Planning Council. Who's going to talk about their policy brief on the widening SNAP gap and some recommendations on the state and city level. This slideshow, it's going to be shown. Also, just to let the committee members know, I emailed it out to you and there's a link on the website. So if you want to see it up close, like in front of your phone, you can go there as well. It's the exact same slideshow. Okay, Benice?
Hi, I'm here.
Hi there, so you may start, introduce yourself and, you can start the, presentation. So what we'll do is, you give your presentation, and then after that, we will take questions and answers from people either on the Zoom or in the room. I will call on them, and then they will speak, and then, you can, address their question. Okay?
Great, thank you, May. Can you all see my screen?
Yes, we can.
Okay, great. Hi, everyone. My name is Benice Mock. I use she, her pronouns, and I work as the advocacy manager with the Chinese American Planning Council. So for those of you that don't know CPC, we are a social service organization that serves Manhattan, Brooklyn, and Queens. And over the past year with the federal impacts and cuts, we did a research project to really help better understand what the impact of cutting of the SNAP benefits would mean for our community members and specifically how we can fight back on the state and city level. So thank you everyone for having us today so that we could really share more what we can be working towards as a community. This is inspired by our research paper, specifically the widening SNAP gap of how federal budget cuts are increasing food insecurity among API and immigrant families served by CPC. When the Big Beautiful Bill, quote unquote, was released, a lot of our community members were really frantic in regards to not knowing how it would impact them. And as a CBO that serves a lot of API and immigrant families, this was a big topic and concern around our constituents and community members, which is why we put together this research report. The information that we use here is based on our CRM system. We have been trying to navigate into a universal intake form, which essentially means that anyone that comes to CPC, any locations, would be intake through this form so that we have a wide range of statistics related to them. And based on our first launch, we had roughly 12K participants that were currently in our system as of December 2025, which is what these numbers are based on. So based on the data that we have as of December of 2025, of the community members that we serve, roughly 442 members are at risk of losing SNAP benefits, and around 4,300 community members are at risk of losing or receiving reduced SNAP benefits. Now, we do serve over 80,000 people every year, so this is really only a sample size of the constituents and community members that we serve. So realistically, we're estimating that about 10K community members will be impacted by the SNAP cuts with the changes of eligibility over time. Now, I know Community Board 3 specifically represents zip codes 1002, 10003, 10009, and 113. So specifically within Manhattan Community Board 3, based on the data that we have, roughly 1,500 community members are at risk of losing or receiving reduced SNAP benefits. And we do want to make very clear that the numbers and metrics based on this data is only the community members that we serve. So within Community Board 3, we're realistically seeing that this is probably a higher number than what we have currently listed on the report here. So, with everything that is going on with food insecurity, CPC has been advocating for quite a wide range of policies and budgetary asks on the state level, specifically the Protect, Invest, and Expand Food Security package that you see on the left over here. It includes a wide range of different policies that would greatly benefit our community, whether it's transitioning to EBT cards for SNAP, expanding eligibility, or simply investing in other programs that would close the gaps that we are seeing on the federal level. So as of right now, in the governor's executive budget, we do see that the EBT chip cards are included in there. 3.7 million for NOEP, 72.8 million for HP NAP, and 55 million for Nourish NY is currently in the governor's budget. We are currently awaiting one House budgets to see what the final numbers are and how that would impact negotiations. And even though the governor has included funding for these specific programs, if you cross-reference the numbers that we're actually advocating for on the community-based level, there is still quite a gap. So for example, the NOEP program, which is the Nutrition Outreach and Education Program, we're asking for 8.5 million, but the governor only allocated 3.7 million. Similarly, for the Hunger Prevention Nutrition Assistance Program, we're asking for 75, and there's only currently 72.8 million included in there, which is a smaller gap than the previous ask. And specifically for Nourish New York, we're asking for 75 million, but only 55 million is accounted for in the governor's budget as of right now. So that's why we have been doing a lot of work in working with our coalitions to advocate and pushing more for these legislations overall. In regards to the city level, we are still putting together our agenda for 2026, and most of it has been inspired by the New York City Food Policy Alliance Coalition that we have historically worked with. And out of the policies that they are advocating for, the ones that are most tangible and eminent for our community members are the ones listed here, which we will be further advocating for this city cycle. So that's specifically increasing funding to 100 million for the Community Food Connection Program, which was previously known as the Emergency Food Assistance Program. We're also advocating for 60 million in congregate meals at older adult centers, specifically because a lot of the times elderlies do not necessarily have like social circles to be enjoying their meals with, or places or the ability to get fresh and warm meals. So that's where that specific ask comes from. The third ask is investing 27 million to expand home delivered meals to 7 days a week. And the last one is to simply maintain discretionary funding for the different initiatives between food pantry, access to health food and nutrition education, and food access and health benefits initiatives. So now how can Community Board 3 get involved? There's 3 ways that we have listed over here. First off is letters of support on the state level and public pressure. I know in previous conversations with Ashley, we were talking about a letter of support, but because of timeline, we don't think that that would be realistic. So really supporting on personal capacities would be super helpful. The second one is to testify at upcoming preliminary budget hearings, specifically with the city. And the last one is CPC is organizing a Pi Day of Action, which is an opportunity for us to bring coalition partners, community members, and electeds to CPC1 to really advocate for the Pi package that we have put together on the state level and to really help electeds understand why it's very important to our community members during the current times. Great. So that's everything that I have ready for today. If there are any questions, feel free to let me know.
So I would ask the committee for questions. Oh, okay. Was it about the city? Maybe we're asking the same question.
Yeah, can you go back to your city advocacy slide?
Yes. This one?
So, we're gonna have a couple of questions. The Community Food Connection, do you know what agency that goes through?
So specifically for that one, no, I could research that and let you all know. So specifically the city agency?
That's a state aid, I'm asking for the city agency, this is the city level.
Yeah, this is city.
Yeah, so just sort of FYI, the community boards are required by charter to respond to the preliminary budget, to write letter of comment. And we already voted last October on many priorities, and now by the 25th, we're gonna discuss it later tonight. We actually have to write comments to the mayor. We can also testify, but we have to submit the written comments. And our comments are go to OMB, Office of Management and Budget, and they go by agency. So if we were to ask for increased funding for this, we would have to do it through the agency.
Got it, okay.
Get back to us. The other thing, I wanted the meals at the older adult centers and the home delivered meals. Do you believe that without this funding, and I don't know the 60 million and 27, I don't know how much more that is than say is being spent this year. Do you think those programs would have to decrease from the current year?
Is this a decrease from the current year one? Is that what
Right.
you're asking?
The older adult or the home delivered meals, if you're comparing what we're expecting to be funded next year to what's currently being funded, do you think that would show a decrease for FY 27?
I'm not entirely familiar with the exact ask that is currently funded on the city level now. I could double check and follow up with you on that as well.
Okay, it would be really helpful to know, is this a decrease, is it holding level, that kind of thing.
Okay. And you mentioned needing to give comments on the preliminary budget, and is that going to happen tonight?
We're gonna talk about it tonight. We have to submit it for all our committees by, I think it's March 25th.
March 25th. Okay. We'll definitely get it to you by next week so that you guys could discuss around that.
Thank you.
Oh, and
Yes.
the maintaining discretionary funding for food pantry initiative, that's like the city council discretionary funding?
Yes. Mm-hmm.
And the last one, access to healthy food and nutrition education initiative, is that also an agency or discretionary funding?
That's discretionary funding. All those are discretionary funding.
Yeah, the last bullet is all discretionary, which is always city council.
Okay.
Yeah.
The agencies don't have the discretionary.
Oh, it's actually one bullet, I'm sorry.
Yeah.
I saw those two. Okay, I understand.
Can we go to the next slide?
Yes.
So the Pi Day of Action, what exactly is that? And are you asking for people to show up? Are you asking for bodies? What are you asking for?
So Pi Day of Action is for us to, so it's going to be 2 hours from 12 to 2 p.m. at CPC 1. The first hour, we are going to have a community art project. We're going to have a big backdrop where community members and staff and participants could write why it's important to be supporting food insecurity within New York City, and they could attach it to the backdrop. And then we're going to use that backdrop as the background for the presser and rally that we're going to have at 1 to 2 p.m. So we're anticipating really just to highlight the importance of the Pi package and to urge electeds to be supporting and signing on for it. So it's supposed to be like a fun, whimsical activity. We're going to have different pies, pizza pies, savory pies, sweet pies, etc. So more so like a community event. If you are interested in bringing participants and bodies, we always welcome that. We do ask that you register if you're bringing people so that we could have a good, so we have enough food for the event.
Yeah, it sounds like maybe, we have a lot of our members work at nonprofits, so maybe if we get the word out, they could bring some of their clients and people to work with.
Yeah, we can follow up with the RSVP form for that then.
Okay.
And the pie is for the state only or for everything?
Pi is state only.
It says citywide. And I assume all of our state, local, electeds are already supporting, right?
I would have to double check on that. Last I heard, we had a budget letter that was going around. What we have been pushing as an organization is just to keep applying pressure, but specifically with these ask and elected support, I would have to double check.
Yeah, I don't think you're gonna have to pressure our electeds too hard.
Okay, that's comforting to know.
Okay, so, any questions from the committee in addition to what we just asked?
No, I took notes. We'll definitely follow up on these asks.
Okay, no, I was asking about questions from the committee that's here in the room. If, because it was just me and Susan asking questions.
Oh, okay.
Anybody? Okay, is there anyone in the Zoom? So if you're in the Zoom and you want to, you're an attendee and you want to ask a question, you should raise your Zoom hand so that we know.
Or people in the audience. Here.
Yeah, people in the audience can raise their real hand, okay? Those in the Zoom should raise their Zoom hand.
Can I ask Carmen a question?
Okay,
Are you aware of any budget issues for FY 27 for older adults?
To be honest, we haven't discussed that yet, so at this juncture, no.
okay, so we'll talk about that. Okay. All right, doesn't look like we have any additional questions, though there's some few things that you need to get back to us on.
Yes, we'll follow up with that.
Okay, great. Well,
Okay, thank you very much.
and thank you, Bernice.
Great, thank you all. Have a good evening.
So, yeah, bye-bye. All right, I'm looking up next.
Budget.
Oh, okay, the next agenda item will be to review the preliminary budget. So I don't know if people have, read what we sent out.
I read it on that.
Oh, good for you. You've not?
No, thank you.
I know people. Always can't see the screen.
Yeah, I have one.
So what I'm handing out in October, we voted on budget priorities. What I'm handing out now is. From the administration is responses. To our budget priorities. And. So there's some categories of responses. And we have started a letter of comment. So when the agencies respond, they actually have like a drop down box, so they. Have to pick their response from the drop down box. And we keep trying to work with them to improve it. But they didn't do a really great job this year.
Okay, and just a letter of comment, I received a draft, Susan, sometime after 5 o'clock today. And I did email it out to committee members, it's just a draft, I think, right?
Do you wanna do that first? Do you wanna,
So if you can access your email, yeah, an attachment, there was.
and we,
sent out with-
yeah, if we could share a screen, it's the second thing I sent out.
Yes, that's the.
Oh, it's there.
She printed it out.
Oh, so good.
It was an attachment,
Yeah, what you talking?
it's a Microsoft,
Yeah, I sent it.
Is it for the people or the?
Yeah.
like after 5.
I sent it around 4, 7,
She sent it off, I sent it after 5.
but I sent it to both of you at 4.
Yeah, right, yeah, so you will have received it twice. Maybe sure. One for you and one for the whole committee.
Well, maybe it's easier to go through the letter first. It was just one, the letter is only one category of response, and then. There are a lot of others to go.
Okay.
The letter of
This one we're
comment,
talking about, correct?
what,
The, this one?
No, it's. Is it, the name of this? Yeah, so it's the city planning, city, somebody, it's the name of
The Mandami.
Yeah, that's the-
Mandami, and, yeah.
That's wrong.
Anybody never used to read that? Or-
You can show it on the screen in case, right?
yeah,
we
so
can show
I
it.
need to see it on the screen to go through. So the letter of comment, we have only addressed one category of responses. And that was the response where, the agency said, where we asked for, expanded funding or expanded programs. And the agency has responded, this request has already been completed. So the letter of comment, and you can scroll through the first part. Yes, so start there. That's it. What we did is we wrote an answer to every priority where the agency said, this has already been completed.
Okay.
So if you could scroll just a little bit so we can see the complete one.
You wanna go up or down?
Yeah.
You want me to go up or down?
I want to go down. Yeah, so expense, so the first one. Oh, she said this is the wrong one I sent to you. I'm sorry, it doesn't say what it is, it says, I'm sorry, I'm gonna read it, I'm gonna find what it is. Yes.
You want this one?
No, I'm gonna, okay, so the first one you see there, that was our request for expanded funding for foster care and child welfare. And their answer was, this has already been completed, so what happened to the letter? Disappeared.
Oh, yeah, I took it off, but.
The letter's only missing the title of the request. So what we did, and I'll explain to you, is every place where they said this program. Has already been, this request has already been completed. What we did is we looked up information about the program and gave a few sentences. This has not been completed, we need more funding, and this is why. So if you're looking, if you'll see that, there's one for ACS for foster care, keep going up. There's one for DHS, which is for homeless outreach, another one is, people said, kind of bigger. DRCD for more residential beds for homeless youth. Another one has, sorry, that's okay, we don't really have to go through all, so I'm gonna say, what we sent you, every place the agency said, this has already been completed. We have answered, said, no, it hasn't, we answered, increased funding, and we still need increased funding, and this is why. So I'm not gonna go over those requests. Then other requests, that I haven't written down, but that we can talk about. So we've asked for a new school, and they say they can support it, but they can't accommodate it. And then we took the Community Education Council's capital request. And we, I think it was the first 5, we made those part of our priorities. And the answer for every one of them is the agency supports but cannot accommodate. What's the matter?
She needs one.
Who?
No.
Oh.
I'm actually.
Oh,
I'm not gonna have this.
Oh, we're not gonna get that.
Their answer is always the same, it's never changing.
So what I think we should put for this one, particularly after the conversation we had with the former chancellor, is that, our schools are old, they go back to 1900. If you're not gonna give us a new school, then you have to commit to upgrading, these old schools and repeat the capital requests, for the old schools. So, there's one of them, we asked for, PS 63 to renovate the auditorium, and they did say that is being done, that's the only one that is being done. So is there any comments or thoughts about that? No?
Okay, now that we're looking at this, and I agree with you on that. Is this this is the past FYI or?
No, it's for coming
For this year.
So in October, next time, in October, you guys voted on priorities for fiscal year 27, which starts in July.
Right.
The first step in that budget process is that generally in January, but because it's new administration in February. The administration gives a preliminary response, and then we respond to their preliminary response. This is for money that's gonna happen starting in July.
Okay. Alright, cause.
So we're already going at the front.
In front of it, yeah, cause I'm seeing here for the ones in the homeless services. Saying that funding for street outreach has more than double
Yes.
years.
Okay, so we're starting with the capital, so
Okay.
so going through now to the expense ones. I think we can probably go through them one by one. So the outreach for homeless services, their answer was this has already been completed. So that goes in the letter, we've already answered it, saying no, it hasn't. We, regardless of what increase you've done, we're asking for another increase. So that is for the facilities also, for St. David's.
Yes.
And then I'm going to,
What did they say yes to them?
well, actually, it's done a few, it's done a few,
Yeah, it must have been taken care
they are gonna carry a few.
That's like this, I won't say entries.
Oh, so the parts are stuck in here because one of our things is stuck on the page.
No, this is for the whole board. So this is the whole board. It's not because this is just it for the whole board. So I'm now going to page 79, where again, they have, so our request for homeless youth and our request our request for the after school programs. This is on page 79.
We only have up to page 72.
Oh,
Yeah,
really?
you only gave us up to page 72.
Oh, I'm sorry, that's my fault. I can't lie.
Yeah, actually, if you just, in my email, I linked it to the whole thing, which is on the, it was
Yeah,
on.
you had to be yeah, and I just explained, I can explain to you what they are. So on page 79, we asked for an increase, for residential beds for homeless youth. They're saying it's already been completed, so that went in the letter saying we want more money. After school programs, they're saying this has been completed. That went in the letter saying we need more money. Then the, let me see. Program to legal services for immigrant youth, they're saying they support, but they cannot accommodate. In other words, they don't have funding. And I'm looking for the next, and that's it, everything else is, it said, this has already been completed, and we're saying we don't care that you give more money, we say much more money.
Can I ask you a question? There's a couple of, on page 64. It says. Agency does, okay, under DOE.
Oh, you know what, I said, we'll go back to the pages, yeah.
What does it mean when they have big bold letters that says explanation? So that it says the agency doesn't support and can't accommodation. And then it says to contact the agency directly and promptly for more information, and it's all caps, is that?
So what I think we should do, and they do that every year, I'm sorry, I skipped the back of the pages when I was going through this. So for both, we want to add social workers to the schools, and we want to add nurses to the schools. And for both of those, they say they do not support and cannot accommodate, contact the agency. So what I suggest we do is ask for a district level meeting with the agency to say what's going on.
Okay, so that's what it means.
And then another one where they say they do support it is, of course, the childcare. That's their, of course, they support that, that's the big thing this year.
They support the childcare, but they did it in every borough, but
But they, so I'm gonna push back on that one,
yeah.
we have less kids, we do.
Yeah, I mean, that's why we have more kids. They have a lot to do with no.
But right now, they're looking for the first year, this is only first year, they're looking at the districts that have the most and lowest income, and even though we have a great deal of need. Those other girls, actually, those other districts have more of a need than we do, they have more kids at lower income. I mean, they are going by costs. And we will get it next year, next week, but it's supposed to be expanded. So that's kind of basically it, I don't feel that responding to the letter is gonna make a big difference, but I feel like if we don't, one is charter mandated, which. No, like so, but the other thing is if we don't, it's like we don't care. So. You know, I think just the comments that we gave, particularly the one about the schools, like, is the one where I think we might have some traction.
The capital stuff.
Yeah, the capital laws where they're saying they won't give us a new school and they won't upgrade the schools that need, the 100-year-old schools. I think if, we answer and say. If you're not gonna give us a new school, which we desperately need, then we need our 100-year-old schools to be upgraded.
Any questions? Committee, no. So is there anything that the committee needs to do right now, or we're just?
No, just if you had any thoughts, any different thoughts about it, I mean, I know we're None of us like the answers, it's particularly hard this year, but because we need to advocate. I did complain already, so the 59 community boards have been working with city planning to try and improve the responses we get from agencies. And I've already complained about, this has been completed, I said, tell them, please don't ever do that again. And they did say, so city planning is going on what they call a roadshow for the agencies to give them feedback, and they are gonna include in the feedback that they shouldn't be doing that. The only time they should say this has been completed is if it's a capital project that has actually been done.
Sure, on page 64, number 4. The enhancing home care services, that is a state issue, not a city issue, and that's how the letters responded where they did. On page 64, the one on
It goes through the Department of Aging,
right.
so it goes to the city agents.
That's why, because I'm just looking at their response.
I have to call them and ask them, but it's not because it's a state, because we had a meeting with them, and don't forget, we meet with the agency. So I think the reason for that is they require us to put in our district needs statement into this software that then connects to the budget requests.
Nice.
And I think it's because of that, but I'm glad you called that out, because I did want to mention that. I'm gonna follow up and say, what do you mean?
All right, just let them know that we, that it says case management agencies. And then that plus in-home care, that translates into like home health aides and home attendants in their state. So that way you don't confuse them on this.
Well, if you look on our website where we have our budget priorities,
Sure.
we also list them very separately and very clearly. So I'm gonna use that, which you guys provided the wording for that, and I'm gonna use that when I speak to them about. This is what we need.
No worries, I just wanna make sure that.
No, very,
You know,
certain,
the whole saying. Okay.
And then there's a number of other senior issues where we say the agency supports, we cannot accommodate, we don't have funding. And I mean, the truth is, it's absolutely important, there's no way you should ever deny service to a senior. But then they also don't have money, so tax the rich.
Exactly. Well, I know about not try doing that, but them and the governor aren't seeing like.
Well, it's election year,
So.
it's not gonna happen.
It's not gonna know.
Okay.
All right,
Okay, so we're
that
done.
was that.
Okay, great. Okay, so our agenda item will be panel planning. So we have started this discussion last month. I did want to ask Susan if you had talked to Manhattan Outreach, and I did actually want to put forth something to the committee.
I'm sorry, I didn't.
Okay. Okay, so as you recall, the plan was to contact Manhattan Outreach and see if they could speak at a panel and if they have other suggestions for other speakers. So at the time, when we discussed it last month, we talked about it mainly as a panel to talk about the issue of street homelessness. There's been a lot of, there's like changes every day, it seems, or different, or at least on the news, it seems. How this administration is gonna deal with this issue.
I haven't seen any way that they said they're gonna do it.
Or there's like news, or,
No, they're not doing it. But I don't know what they're doing.
Okay, so we don't know what they're doing. Okay, but it needs to be doing something. So, yeah, and at the last meeting, we felt like, they need to do something, so that's why we wanted to have this panel.
I have no doubt that they would come speak.
Okay, it would come to. Oh, DHS or Manhattan Outreach?
Both,
Okay,
it depends on who you want.
okay, so somebody will come and speak. Now, my other question is, I kind of wanted to find out from the committee, ask you again. There are several ways to address this issue. We can have a panel, like the way we have done in the past. You know, 4 or 5 people, we plan it, we plan the questions, they come and speak to us and address their area. Or we could have this issue addressed in a regular committee meeting. It could be at one meeting or more than one meeting, you know, So which one do you prefer?
How would you address it?
How would you, huh?
If you addressed it in a committee meeting, how would you address it?
We would invite one of the speakers.
So the difference is instead of having a panel, you would have 1 or 2 speakers.
Yeah, 1 or 2, and, you know, if one couldn't make it, I mean, someone could come the next month too. So it would be the same issue being addressed, you know, so it could be done that way. Now, if the majority of people want to do that, if people want to have it as a panel, like we started talking about last month, then we'll continue planning the panel for this topic. Now, if committee members would rather, you know, the majority or all committee members would rather have this issue addressed.
I wonder why that's. Do I have to do something? I'm wondering why it's showing the screen. Go ahead, I'll get the tech that.
Oh, okay, so if committee members would rather that this issue we're talking about, the street homeless. Be addressed like in one, you know, we invite 1 or 2 speakers to a meeting and talk about the topic like we usually do. We could do that, and then we can. Go ahead and then decide what we want to do with the panel. Do we want to do the panel this year? And if so, what will be the topic?
That screen just shows.
So do you understand?
Yeah.
Okay, does everybody understand? Understand? Okay.
So they should see whatever.
Yeah,
I'm trying to put the video on Zoom.
What?
Okay.
I'm sorry, it's funny. Maybe it doesn't matter.
I was not.
Maybe it doesn't matter. I think.
I think she's trying to make the video of the room be the biggest, so I tried pinning it on the Zoom, but that didn't work. Yeah. There we go.
Thank you.
Thank you.
Magic. Okay, I'm sorry. I'm sorry.
Okay, we're ready? Okay, she's has 6 or, okay. Okay. Okay, so I want to get this is not a formal vote, but it's more like a temperature check to see what we want to do. Okay, do we want this topic as just a regular agenda item or as a panel? Okay,
Or
how many,
I was gonna say, not many people are interested.
or maybe you're not interested at all, you know.
Well, that would all depend, May, but there's something that we wanna share with the public?
We could share it either way, I mean, we can always share things with the public, I mean, all the meetings are public.
Anything
Or
or
you
you
have,
have.
okay.
So, you know, but you know, how do you want to share it, you know? And you know, it can be equally, so sometimes the panel is more like, you know, we dive into different topics. And actually, quite frankly, all of our panels have been, you know, they broaden out. You know, that's typically the way it's been, typically the way, if you have been, I mean, most of you have been on the committee, you know. For a number of years and helped plan other panels, you know, where we designed it and then it always becomes broader. Maybe it's about senior citizens, but it's the broad range, you know, it's about youth, it's a broader range, so. It's not just this, you know, we don't just zero in on this one thing. So like I said, either way, for this topic of the homelessness, I think, you know, what's going on right now, it is really pressing. But we could address it either way. It can be in a meeting and everything is shared.
So the question is whether we should.
Yes.
Address this in a meeting or do.
Yeah, right, and also it doesn't have to be a single meeting, if you look at all of our meetings, sometimes we had the same topic. Addressed, over several meetings, sometimes there were new developments or speakers who came at different times, so it is, So, it can be, either way. So what do you guys want? Do we have a? I wanna take a temperature check, so I know which way to go. So we know which way to go.
I would say that for the big topics, like, homelessness and aging or what have you, we can have a larger panel discussion. And invite, whether it's the local shelters in the area to come and give their opinion, or the local, senior centers and so on, during the meeting time when they're available, because sometimes in the evening they may not be.
Well, it would be the providers, I mean, like,
Right.
if,
Well, the
let's say, if,
The,
say, like, say, someone's from men's shelter, it wouldn't be someone in the shelter, it would be someone from Project Renewal.
right,
Or it's just the same thing, the senior center, it might be
Right.
DRC.
So there are people who work directly with them, so.
Right.
But, I mean, those are two very big issues, I would do several.
that's what I'm saying,
And it's-
separate issues on topic,
Yeah,
on the bigger topics,
yeah,
that,
people are actually gonna answer questions. And
right,
actually-
an opportunity to speak.
Yeah, and actually bring something different, because we keep bringing the same agencies to say the same thing that they're doing, and basically rotating the same meeting.
Well, we generally don't have any, rarely have
They
any.
don't come either,
Well, because we don't ask them.
so that's what I'm
Yeah.
saying, so we should maybe this year, focus on, let's get something done, but can we speak to someone who can actually help us get some?
Wait, okay, we're kind of going all over the map again, one thing at a time.
Okay,
First of all-
I'm not gonna go over that.
Okay.
What I'm saying is,
Yeah.
instead of having those agencies, the homeless shelter agent, or the shelters in the community come and talk and present and talk about the same thing that they did the last time that we did this.
Mhm.
Why don't we have the homelessness and something like that, we'll have a whole meeting on it. And we get agencies here that actually do something and actually can give support where we are lacking. Or something like in that sense, instead of just getting the same agencies to come and see what they do.
Well, that was
Yeah.
my question, but anyway,
Yeah, can I respond?
yeah,
So we don't have, I don't think we've ever had, for instance, we've never talked about, I believe, street homelessness, so I don't think we've ever, but as far as the agencies are concerned, this is my take. We do meet with the agencies, not the whole committee, but we do have those, and we say to them, why are we doing this, why can we do this? They are never gonna answer you honestly, particularly in public, because the administration, all past administrations, it's not gonna change. Everything is fine, everything is wonderful, everything is working perfectly. When you get the actual providers who get the money, they're the ones that are gonna tell you what is not happening, where there's not enough money, where people are going hungry, where they can't provide services. And I think even the survey we did last year, so then we can advocate. The agencies, like you have a Department of Aging, they've answered us, we don't have funding, we're not doing it. That's,
right, so agencies tell you that everything is fine, or, they tell
Oh,
you,
yeah.
or they tell you what is supposed to be happening. But the people on the ground tell you what is really happening, so we want the people on the ground. And she does have these meetings, in her, like her service cabinet, where she meets with the agencies. So they're that kind of, but for us, it is always valuable to hear from people on the ground. So that people who work directly or.
We did have a meeting like that about,
we did have one on homelessness, it wasn't street homelessness.
no, it was like, seniors and focus on homelessness, and I know that an agency came in that was about it. Some seniors offer their house.
Right, yeah, so
So
that was.
I don't have something to do with, that was another program that they introduced, the thing, yeah.
Yes.
What did you say?
Oh,
The room that-
yeah, Citizen Foundation. Or-
Yeah, because they want you to go out and spread the word.
Yeah,
So the people who are gonna make things happen is when city council and the mayor go back and forth in the budget dance. It isn't the agency that makes it happen, it's the agency. When they get the money, they do with it what they're told to do with it. The city council and the mayor, so. You know, getting your city council people to advocate for the priorities for this board is where you have to make things happen.
So getting back to this,
For May, just one last thing on it. Right now, we have a brand new administration, we have new commissioners, and we have new council people. So,
This is the mayor answering you.
okay,
This is our current mayor answering.
okay.
alright, so what
Sorry.
But I'm saying, just found out we got a new commissioner Brady, and it's like, oh, does she know what's happening?
They have no money.
So just to check again, so what we're saying is for the topic of, let's say, homelessness, we're generally just trying to talk to folks on the ground to see like what are the major problems facing them and if that would be the objective.
Well, that is generally always the approach, whether you have a panel, whether you invite them to a meeting, it's generally always the approach. So, you know,
I don't think that's what.
I think she's asking from what you guys were saying earlier.
Yeah.
Yeah.
Is the topic of the panel, forgive me if I'm mistaken, the topic of the panel is trying to. Figure out what is the best practice for us to have the panel of who are we gonna have on the panel. So if I wasn't here when you guys had the panel, however, I feel like if we're gonna do it, it needs to be impactful. Is the people that are on the ground, like they work in, that go out to make sure what's going on with people who are homeless. What's impacting them for not being able to go where they need to go? Like we have certain things that people say that they don't wanna do certain things, but it's in different areas. And I think because our area is different from the west side, having people who. I guess in our area, what is the issue that they're coming, like, what is the pushback that they're getting?
like, is that what you're talking about?
Actually, I'm just asking like, what's the objective of the meeting?
Okay, so the objective of what we're doing right now is to try to decide, is to continue the discussion we had last month. I know you weren't here last month,
Yes.
so at the time, the discussion was to do panel planning, and then I kind of introduced this topic, you know. And I got the sense that, you know, everyone is, we're all interested in homeless, no one said we shouldn't do it, but there was a little bit of, well, you know, we did this is what our panel, we did this last panel 2 years ago, you know, and actually many of our panels have touched on that. But so our panels have always been something the committee like designed together. It was kind of like a little bit organic, and then the topics tend to be. It's like, I mean, I heard people talking, you know, we talked about the homeless and then someone talked about, you know, sort of like, oh, the churches, how they, you know, it's broader than just the street homeless. You know, the different, things that impact homelessness. You know, that's kind of what I heard. So that's what I wanted to ask you again. Like I said, I think this thing about this, you know, the street homeless, it's just an urgent issue. However, if we want, we could address it as a panel, or we could just address it in a regular meeting and invite the same speakers. You know, and then it's sort of less work, we don't have to design as much. So we can do that. If we decide to do that, we would do that. And then after that, we'll see, what do we want to do with this panel? Do we want to have a panel this year? We don't have a panel every single year. Maybe we do, maybe we don't. And if that's the case, then we should go about our usual approach of designing the panel, which is to, you know, kind of brainstorm some ideas. You know, and it's also based on, you know, what we've done in the past. It's not like a total. It's not like a total, you know, anything.
It's just like when you say like address it, like. What is the output usually, we're trying to address the street homelessness problem, like, usually like as the output?
Oh, so yeah, so there might be, we could find maybe, for example, you know, what is the city doing now about something? You know, we could hear from people who work on the ground. You know, what do we need to advocate for? Do we need a resolution to have the city, you know, address do these things or do those things or improve on certain things? Or is it just for information? So that could be an output, could be a resolution that we could use to advocate to the city that they need to do A, B, C, or less of A, B, and C.
But it's like hearing so that we can understand what we should advocate for if there's gaps.
Yeah, gaps or, you know, I mean,
And budget,
budget, yeah.
information on budget priorities.
So it doesn't have to be information on budget priorities. They need to fund certain things more, you know what I mean?
Or could be separate, yeah.
Yeah.
If I can give like an example of the difference between an agency or a provider. So an agency, like we asked for increased funding for homeless outreach workers, and their answer is. There's plenty of money, you just gave an increase. However, when you talk to the like Manhattan Outreach Consortium, who actually hires and supervises the people, they will tell you about pay parity and why they will get people for a year who will then leave and go someplace else, because no matter how much money the city put in, it's not as much as other organizations are paying. And that's the kind of specifics that you'll get. And we say another thing I think that the committee did 2 years ago that I thought, I think it was 2 years ago, that I thought was really excellent. It was, you had a sidebar, with a story of an immigrant family.
This was last year, yeah.
That was last year.
Right.
And we've done that before. We did it once for a senior center where they talked about the ceiling, University of some of the ceiling falling in, but they were personalized. We took the issue and then we gave a personal example. And I think that's really, really powerful. And a lot of people read our district needs statement, a
Yeah.
lot more than you think.
Yeah, also the sidebar, sort of manifests itself in different ways. The senior citizen center, sidebar came from a panel we had of like 4 or 5 senior centers. And we chose one to highlight their story. The immigrant story sidebar was, we just, you know, Ralph and Larry just worked together to interview somebody. So that was last year. We did not have a panel on that though. But so it's a little bit different, yeah.
And it's very powerful.
Yeah, so those are starters, yeah, those are powerful.
Are these, are there any other priorities besides homelessness that we should prioritize?
Anyone?
Any
Other
other?
priorities that we should prioritize?
Senior school. Nothing serious.
But you know, like, one that maybe we can combine and do two, like, you know, like maybe do one meeting on this and then one meeting on that, instead of doing a panel, so we can have one. We did one already 2 years ago, maybe focus on talking about this specific subject, like homelessness. We take one meeting to specifically talk about it, to talk to the people, see what's on the ground, and then from there we collect, we get all the information, and then move forward with that to see how can we use the information that we got, and then maybe have another meeting to focus on another issue that we are, or anybody can feel that is important to.
You know, it could, so just like regular meeting.
Yeah, and just focus on, like, this month, we're gonna focus on this, next month, we're gonna focus on this.
So are we leaning towards not doing a panel this year? I'm not, you know, are we leaning more towards not doing a panel this year?
And just do like the boots on the ground.
Yeah.
Come and talk.
Either way, yeah,
We don't
I
have
think we
to,
get more information from the boots on the ground than actually getting information from.
they're the same people.
Yeah, it's the same thing, it's really the same thing, you know?
You know what I'm saying? The people you have come to the
Yeah.
committee are the same people that.
So maybe by having one meeting and then learning and getting information and see what we can gather and use that somewhere, or maybe if we out of that, we get a resolution that we think it's a good idea, then. I think it's better focus on one thing instead of having one meeting with 7 different things that by the time I'm on the 7th subject, I've already forgot everything that we spoke about already. I don't know, that's just me, you know?
okay, so let me take another temperature check in the room. How many people don't want to do the panel this year? Okay.
Wow.
Okay, I don't care either way, I'll go with what, I'm sorry, I was raising my hand, say that you should raise your hand. Okay, so there was,
No, yeah.
1, 2, 3, 4.
okay. Okay, so that stops it, okay. Okay, so now, we'll Okay, so we're not planning a panel, I guess it's, we're done with that one, we can. In terms of future agenda items, we do, just to let you know that for April, we do have the, IBO, the Independent Budget Office to come. And they're, because we invited them, actually, we wanted to come this month, but they didn't. They have a report on the Be Heard program, with B dash HEARD, it's like a mental health crisis.
Yeah, it's the one where the mental health respond to emergency mental health crisis instead of the police, which we have advocated to have that pilot expanded until we gave up, but now the new administration's picking it up again.
So they do have report, their reports are meant as tools. I mean, they don't advocate for a position, I mean, that's why they're independent, but they're meant to be tools that we or anybody can use. For to advocate for stuff, like we use their schools report to advocate about how we needed. Better school, They had a report about outdated schools facilities, and so we use that for us. Okay. So they're willing to come in April just to talk about that. So the reports are about certain things, it's, but I thought that was, it's about mental health and homelessness and crisis. But it was relevant for us. And it covers different areas and different places, sort of needs or what's lacking. So sometimes though, it means that we won't get like everybody in one day because there's a scheduling issue, but we could get everyone in eventually. Like we can't expect like every day, every meeting to be one topic, right? Yeah, and then we also sometimes just get requests from people who want. Stuff.
Keep it to like 1 or 2 topics, because I think we have 3 or 4, it just kind of gets lost. Yeah, it's too overwhelming in one meeting.
What happens is that people request, like recently, we've had most of our agenda items are people requesting to be on the agenda. And it's
But
because,
yeah, but it's like, it's just too much if it's more than 2 or like it's 3 items, it gets kind of overwhelming for a meeting.
I agree, they try really hard to keep it down, sometimes it's a time issue. Like recently, the people that came to advocate for us, it's because they needed to for budget by a certain time that. But you're right, that's actually a problem with most of the committees, it's really, really hard to keep it. Keep it reasonable.
Okay.
I don't know if anything, I mean, I'll talk about it. For the cameras reports, but I don't know if we're gonna end up with anything about the Bellevue issue on. I don't know.
That will put that in our CAB report thing, okay.
I'll talk about it,
Okay.
but I don't know if that's something that's eventually.
Yeah, I do wish that it could be a little bit more like succinct each meeting, but we do need to be responsive to the community and where they're asking us to consider something. It's not something like, I mean, we consider almost everything, whether or not we should approve it or not.
Transportation's much worse.
Yeah.
Yeah, no, I think.
The biggest ones. And
So it's the nature of community board, we need to respond as well, be responsive to others. Okay. All right, so, okay, so next month we'll have Be Heard. Yeah, they said they were coming, right? We just have to.
Yeah,
Okay. All right, so should we move on to the next thing is CAB and CEC reports?
yes,
Okay.
Are we not doing the planning?
Oh, okay, planning for term limits. So, I actually don't really have anything. So I did want to note to you that, first of all, if you look at our website, remember we promised that there would be these folders. The folders are there. Each committee has a folder for their term limit planning. And I am proud to say we are the first ones up there. So the other folders are empty, but we have 2 things in our folder. Okay.
and I had one of the other chairs complain to me that when I kept talking about what base committee does, it makes them all look bad.
So I was looking around in the other folders, because I thought we needed to do more, and I couldn't figure out what it was, but. So we didn't have any, so I did want to, I do want to continue this, because, and I wanted to hear from you if there's any other topics that we should address. So it's about planning for term limits and just a little bit more about process and procedure. I mean, it's just like, we need to do a report. I mean, we don't need don't just do a report, right? So. But it's more documenting things that we have done in the past, or people understanding the procedure. Maybe there's something you don't understand already and that should be documented in there, so. How it's done, so we have the annual schedule, a lot of it revolves around the budget. There was a little thing on the panel planning.
Do you have
And the
anything
thing
on the
about-
survey? You've been giving out surveys for
Yeah.
budget stuff. Did you have something on the survey?
All I had in there was the survey from last year,
A sample survey?
a sample survey from last year. And it was 5 questions, so. And then the other one, the other big thing was about how to get it, how an item gets onto the agenda. So do you wanna do more in the sample survey or? I mean, a sample survey, it changes a little bit each year, you have to sort of adapt, a little bit.
Maybe you just wanna put in some commentary about how and why you adapted or something. Maybe just some context for it.
Oh, okay. Now I could put more context into it, because it's just part of the process about how we, get information, it's. People give us information in different ways. The same organization, then that's just how it works with organizations or people talk to. Some people are very good at just telling us, and some people act like you have to survey that. Anything else on this? Ramya, Pleasure, Robin, and Ronnie. Term limits planning? No? Okay. All right, so that's term limits planning. What is the next thing, the CEC report? Okay, CAB report from CEC, there's a lot of news, I have CAB reports.
Go.
Oh, yeah, okay, I'll do CAB report, she has a big CAB report. A very big one, okay, so I'll give mine first, I went to the Bellevue CAB, had a legislative breakfast. It was last week or a couple weeks ago. They had it up at Bellevue, it was a state legislative breakfast, so they had all the state elected officials there. They have a slideshow. They're making certain asks, the 2 big ones that I recall is that number one, they're looking for a lot of capital money to sort of renovate Bellevue and make it more like comfortable and more open. It's like, it's like dark and there's not enough space and, it was interesting because I ran into, somebody who used to be on this committee who was visiting, her husband, he's been there a few days and she goes, there's no place for me to go, I'm here every single day and I have to go hang out in the lobby if I want to get work done. In that big lobby in the front, like there's no, so she's talking about how it wasn't comfortable, and she said, oh, she's really appreciative that they have all this room for, like the warming shelter. But it's like, I just don't have any place to go, I wanna go come visit my husband. And I told her I was gonna go to the bathroom and she said, there's these girls in the bathroom hanging out by her windowsill. I'm like, okay. And so that's what they're talking about, and how, some corners are dark and sometimes it's not safe, and so they're looking for that. And then they also mentioned their their youth mental health program. They want to expand it to include more like you can be hospitalized there to have beds, right now it's like a clinic, it's you can't, there's not that much inpatient beds, and they said that now that Mount Sinai has closed, they're seeing more of a need, so that's what they were asking for. The other thing is the CAB membership. So the CAB chair, she was at our meeting, There was, what's her name, Karen, I think, Karen Moore.
You got my meeting too.
Oh, yeah, oh. So that your cat meeting?
Yeah, because of the.
Who's this? Karen Moore, she's the, Bellevue. She came.
Right, I remember.
Yeah. So she sent me an email and said, they would love to have a CBC member on their tab, she sent me the application. So if you fill it out, you have to go, a member should, it's like any other tab, you should be like a consumer. You need to go to, you need to fill out the application, send it in. It's reviewed internally and then reviewed by the CAB. If someone is interested, they have to go to 2 meetings before they are approved to be in the CAB. There was no mention of the borough president, and I did not ask.
But they want someone who uses.
Yeah, they want to, yeah, so that's, I think for all CABs, like, right, they want someone who's like a consumer of that hospital. And the meetings are on a Wednesday. The 3rd or 4th Wednesday. Maybe the 4th Wednesday, I have it here, so if anyone is interested. I can pass it
Anyone you spelled here.
Yeah, I can pass you the application. And if I were to do so, I would also say to her, you know, I'm passing this application to one of the committee members. I mean, they don't ask for a letter of recommendation, but I will. Anyone here interested in,
No one uses Bellevue.
no one moves about it?
My mom.
Well, you're already in a lot of things.
Yeah.
Then your mother.
That's my mom, right? That's a complaint.
All right,
So maybe we have to reach out.
Yeah.
What day is it, what time is it on Wednesday?
oh, they're always in the evenings, but aren't they always, can't be always, they're always like around 6 or 6:30. Okay,
So maybe find out from the board if anyone uses Bellevue. So do.
okay,
My turn.
okay, now,
So I don't know how many of you read the Times this morning or the Optimist or read the mayor's press release. But Bellevue Intake Center on 30th Street and Shelter is having structural problems, has to be empty. They're actually gonna demolish the building. And so they have to replace assessment beds and they have to replace intake. And the intake, which is gonna be a couple hundred men per day, is going to move to 83rd Street, the 3rd Street Men's Shelter. This is a really big deal. And then the family intake, I believe it's families without children. Families without children intake is gonna be at Kenton Hall at 333 Bowery. This all happened this afternoon. Well, there was announcements today and then I got the call from DSS early this afternoon. It was like, just couldn't believe it. And then I spoke to our council person who had also gotten the call, and then he spoke to Project Renewal, there was just shelter there, and I called the head of security for Project Renewal, we sort of really don't know what's happening. And we're all sort of asking different questions and getting different information, so what we have all agreed upon is to ask for a briefing meeting with community board, the council office, elected officials, and Project Renewal and the police and social services. So we could ask questions and, you know, there's things that come to mind, like there's the biggest police response to calls is at Project Renewal. So if we're changing from or adding a couple of hundred, I don't know if this is adding, I don't know if it's instead of, but it's gonna be more impactful. We need more resources, we need the security to have more money, we need the police to have more resources. Because otherwise they'll be like consumed with responding there. So there's just right now a lot of questions. It's a really big deal, it's got a very big impact. And I don't think we're gonna have any voice, we don't have decision making, even advisory decision making on these kind of things, we're notified. But I think we're very, very important in
talking about how it impacts the community and how to mitigate issues and how to make sure that people being served at these centers are served properly. So that's what I know and what I don't know at this point.
So 30th Street is gonna be, okay, is that gonna be the men's thing and then?
The beds are not, the intake beds are not coming to our community, the intake beds are being spread, the assessment beds are being located in other places. It's the intake, but the intake, my understanding, I don't know, is 24 hours a day.
No, intake is not 24.
Well, they were telling me it was, that people can go there they can go to the intake center 24 hours a day.
That's what my son used to work at that one, he did custodial there, and I know that there's a stop time before they take him over intake.
But that doesn't mean that they don't have people coming in for whatever, I don't know if they're waiting there overnight, whatever.
No, there's a stop time that there's no one there to take intake, that's what I'm saying. Like, there's not, that I know of that was 24 hours, it might have changed, but I knew about that one closely, because he doesn't work in that one anymore.
And so I don't know, these are all things that we really need to find out. So that's the news of the day.
Are they gonna, like, send us a
And
letter or
then
something?
Sport 6, they're gonna have to go through, I guess, the ULIP process. It's gonna take years. It's gonna take a lot of years. I mean, I'm sure the place really needs to be,
Oh, yeah.
No, it's really.
It really does.
I mean, I think the same thing with Third Street Men's Shelter, I think that should be replaced. But that's my news of the day.
Okay, next, tabs, let's run tabs, let's go to
Yeah,
hospitals.
new year, we just had our walkthrough with, the elected officials and we had our Lunar New Year event. Yeah, down the drive. They had a beautiful performance for us, some of the elected officials couldn't make it because some of them were not, but the one drive home and did do a walkthrough. We are asking for monies, money. We need a new CT machine. And, that's what we're looking forward to. We gave a packet to, all the elected officials of all the requests, which I can send you guys a copy so you guys can have what our immediate need of what we need money for. But one of the CTs is one of them, and then we need a wash, like a plate dishwasher, because the one that we have cannot accommodate the amount of plates that we use in the seniors, in the nursing home, so they wanted like an industrial one so that it could make the lunches that they do faster and. The process is easier, so, and it will last a few years, because it's gonna be a good machine and, that was fast, and now what we're planning for is, the next few months, we're planning for, changing seats. Because now, Paulina has been the chair for 2 years, so she's gonna have that down. And then, right now, we're just trying to get an official, support. That's in the cabinet. So I'm gonna send you guys, some maybe the cabinet that what they're asking for specifically, just so that you can have an idea of what is it that they're asking for, which we just got it a few days ago, and then that's what we gave the elected officials. And then, yeah, that was it. We're planning for the summer events that are coming up. COVID is down. And there's a lot, there's 78%, almost 80% of nurses and staff that have gotten their flu shots and their vaccines and all of that. If they refuse to, you don't have to wear a mask, or, then we are trying to work with the Mente Center to help with to work together in collaboration and to help with mental health services. So that we can have their patients refer to them and us refer to them, so we can do that in collaboration with them. So that's what they're working on. Right.
And I went to the Lunar New Year Pension.
Oh, yeah, it was beautiful. It's so nice. Gotta go to gym.
Where is that? They specifically invited me.
Oh, of course, you're VIP. And that they wanna renovate that one, that space that they have there, they wanna renovate that too, which is the space with having events, they wanna
They
renovate.
had 5 of their nursing home people who were hungry.
Yeah, so we literally stood next to, like, right there's 500 years.
Wow.
They were set us up, they must have been they look good, like they. Like, okay, we're gonna just go.
They looked really good.
They look amazing. I'm pretty sure they're like, take 3. I was there with barbecue party.
It's like, it's like secret.
I was like, I don't go back then.
So the big question is, can we use that space for community meeting?
I can ask Daniel,
Because we used to at one time and then we couldn't during COVID and then they were opening up. If you could ask, that would be.
I'll ask the friend, I see it.
Because it's a very nice space.
I see it in my building.
Yeah.
Oh, right here, 500.
You.
This is, they didn't pull this one, look, 1, 2, 3, 4, okay, 1 step back, oh, 5. Let's go, look at it.
They're all from.
And they're
Yeah.
coming from,
I think go over.
they look so good, I was like, oh.
I really have to have that tea that they're drinking.
I said, what you drinking, what are you drinking? She was like, honey.
Alright, okay, we'll look at the picture.
Oh, they have a big envelopes. Yes, we also have a.
I live in District 2, I mean, I used to stand how it is. I don't know if it's time to use it.
So, CDC, we are working on, so we are working in collaboration to bring the Girl Scouts to the Lower East Side, so we had a meeting last month and one of the Girl Scouts, I tried to do the Boy Scouts, but they didn't reply. So we're trying to bring the Girl Scouts into every school, just have a little something, parents that are willing to do it. We did that, this month I'm having Apple Bank. Right here to come and support and just introduce themselves, see if we can have them in middle school, because, I had a lot of issues with my SYP kids,
We're talking about the CC, right?
yeah, the SYP kids had a lot of issues with people stealing their money and cards and all of that, so I'm encouraging all these kids, hey. Apple Bank is right there, they're not really good at technology, but they're free, right? So it's a nice way to, start these kids, I'd like to come up with the one, they never came and, Chase, they always say they come, but they never do. So I was like, you know what, it's right there in the community. And then, we did get the, the fence removed from PS15.
So I got some, thanks for that.
We got, it's about that, but you know what, when 5 or 6 tires fall and have accidents all by the door. Yeah, like we tried, they put a cone, they put wires, they put everything, the cars are still falling, and I understand that. And my thing was, well, let's talk to elected officials, or talk to the policing, and tell them to have more policing in the morning, and I spoke to the school safety, and more policing at 3 and at 6. Just to get them to know that they are parents there, that they, that they are kids coming out of these schools and that there's controlling, so that they can leave. But the drugs and all of that, it's not only in that school, like, you find out, either it's all over. And I get that they wanted the fence to feel protected, but the thing is that we would have more accidents than anything. They put a cone, they put everything, and it was not, and it was just one stick. And they're like, okay, let's remove the stick, if we remove that stick, the fence is gonna fall over, mind you, that fence. It was like 15, 18, how many years old already, so then we moved that, then we moved the carpet on the. In the library because it was so disgusting and destroyed, right now we are working on, UNMS is working on the windows, 142 is working on their windows and the leak that they had, that's been fixed. PS 110 is falling apart, we already know that, on it, it's approved, the capital's happening. The park in PS 20, so we have the big park that the smart, they gave the money for and allocated for that, but we are focusing on the little park. That they were using as construction, which is like the little kids use that park. So we have to block it off with a little construction of the building and they messed it up, so now it's been approved. And we are gonna get it fixed supposedly during the summer, which I don't even know why, but they don't even use it. So that's one thing that we're.
Here's a school issue that I'm gonna add on,
I have
Yes.
one to mention too, so.
pardon?
I have one to mention now that you.
Oh, I'm sorry, go ahead.
No, you go.
PS 63 neighborhood school. I've had complaints about the parents, they double park. It's a first responder, Third Street and Fourth Street are first responder throughways because they're the only streets they go through. And we have the fire department, right there on Second Street. And I had complaints from actually the parents about the parents that were double parking. And they leave their cars and then they go in to take their kids to the classroom. And meanwhile, the cars are just there now.
The whole time, you know.
So yesterday I was walking home at 5:30. Because I live on that block. And there's an ambulance, lights and sirens and all that, and they cannot go because there is a pair double parked, the car's empty. And this went on for like 4 or 5 minutes with the sirens and everything going. And finally, the parent comes out with the kid. I mean, that could be life and death. And it's selfish, it's selfish, it's just selfish. I don't know if these are all very young kids, because I certainly can't see why a first grader or second grader can't go just.
Yeah.
drop off.
Usually the kindergarten, I get dropped off, but have you,
This was at 5:30,
that's picking up, that's after school.
but this happening, well, this was at 5:30.
Well, okay.
So I am going to ask the police to do. I'm going to ask the police to do more taking there. And I'm going to suggest to the school, there's loads of ways they can deal with it. They can have parents out there.
I'm gonna write an email to, I'm gonna put you an email, and I'm gonna say, hey, this was brought up in one of these meetings, the issues of that carry. Then go talk to the principal and take care of it, because.
They can have kids.
They don't have to have, one of the parents.
They may have kids, I don't know why. I'm sorry, kids are so covered over these days, but they can have a 5th grader out there to gather the kids and take them into.
They usually do have the parent coordinator supposed to be outside in front of the door.
Well, it's,
Well, they're gonna have to figure it out, because they. need to-
yes, but the thing is, it's bad enough, like, there's been a lot of construction on the street with the NYCHA housing. It's bad enough in general, but when it's threatening people's lives, it just kinda.
So I'm gonna email that today, I'm gonna put you the email and the meeting, and I'm gonna put you guys in with Karen and Christine, so that they can address the issue. Yeah.
I have talked to Carrie about it previously, but that was before it was the life and death issue.
Yeah, but now it's more serious, and she didn't do nothing about it, it's the second time that we're bringing it up, so find a solution.
Yeah.
Now we're gonna find. And it's not gonna be cute, but we do have an issue, there's some, puffs. You know puff? Okay, so on Clinton Street, Global Leaders is right here. Right next to it, they opened up a new puff. That people buy deliveries and they have like a whole base there, and it's full, they sell everything. They're selling liquor there. They do not have a liquor license, so they're in the 40-something street, and then
Send me an email, yes.
okay, because then I have videos.
That's easy.
Yes, and so I put my school, my kids crossing the street.
That's easy, the state liquor authority responds just like that.
Okay, so I'm gonna send that to you tonight, because I was just, not sending you the video, but just to give you an update, and I was just like, this is insane when I looked in. But in during the day, it's dark completely, but at night, I have lights on. I was literally coming walking by, and I'm like,
Back storefront.
yeah, and I'm looking at, I'm like.
That'll be easy, it's the state enforces.
It's, so you see, okay, you see the block of Burger King, this is Burger King, if you go about one block, right there is the old leaders.
Yeah.
That old theater. And there they have a whole club there, and you could never see it during the day because it has like tinted, but at night they took the light on, and I saw all liquor, I'm like.
Okay, that means.
And then I don't want to be messy.
That
I'd be like,
means.
oh, they should take care of it. They would, except their liquor license, the whole country, there's no liquor license there.
And actually, there's no liquor license at all, the city can shut it down.
Yep.
Because the state doesn't have jurisdiction, they don't have any license, the state doesn't have.
I'm sending complaining emails. Oh, and I'm working with the Valadics, CC1 is working with the Valadics to bring in, I wanna do that with all NYCHA residents associations, they're fixing their PTA room, resident room, and we're gonna try to see if we can put a New York City read little corner for the kids there, so that they can read and encourage them to read, just like we did in Essex Crossing. So we're working on that too.
Awesome.
And working on the census, sorry, I'm gonna collaborate with the census call center to bring them to UNMS, because UNMS has a whole medical room there that they're not using, because they left. The medical team that they left, and the census already is trying to do all PS 120. So if we could just add them there so that they can see the kids, and we're gonna have eye doctors and all that, they're gonna be collaborating with, UNMS hopefully.
Great, okay, thanks for your reports, so a lot's happening.
We'll take it over.
I think that's it, right? Eric's not here, so he's not here to give any reports. I think that's he's out sick right now,
Roll call.
yes, roll call, okay, so this is the roll call to adjourn.
Bailey,
Yes,
by Ben is absent, yes, absent, you should feel it's present. Noema, Lafana is not here, Monica Carr is not here, Browman is here, Raima.
Yes.
Hang on, sorry, Ravi here, and that is on, it's Aviv and Carmen. What should I put in the box for,
E, right?
Yeah. we'll do it.
So send it to me.
I'm gonna do one second.
Oh,
Send it to you.
What I'm gonna do is just gray out her attendance,
okay.
so when I'm before. Okay, I can end the meeting?
Yes, we're ending the meeting, okay.